Hi, this is Galit Goldfarb. Thank you very much for joining me here today. Today I'm going to be talking about how diet and supplements can help rheumatoid arthritis. Rheumatoid arthritis is a chronic autoimmune inflammatory disease that affects the whole body and leads to cartilage, joint, and bone destruction. Rheumatoid arthritis is a very debilitating disease that may lead to difficulty doing many daily activities. The pain and stiffness can be very frustrating and challenging. 2% of the global population suffers from this disease. However, there are significant variations between different populations. More than 50 million Americans are thought to be living with rheumatoid arthritis, with over 300,000 children suffering from the disease. Rheumatoid arthritis is caused by genetic and environmental factors and takes many years before the onset of the disease is observed. The environmental factors that lead to this disease include cigarette smoking, air pollution, dust, infections, and faulty diet habits. Diet and nutrient status have been found to have a central role in the disease risk and progression. An extensive prospective study that followed 170,000 women that were free of rheumatoid arthritis at baseline. They wanted to establish a relationship between healthy eating patterns and rheumatoid arthritis risk, concluded that a better diet quality for women aged under 55 years was associated with lower rheumatoid arthritis risk. Now, there are higher numbers of rheumatoid arthritis patients in Western world countries than in Eastern and developing countries. Depending on the properties of foods, dietary habits can represent both disease risk and protective factors. For example, a high red meat intake often characterizes the Western world diet. It is also high in saturated fats and trans fats and has a very low omega-3 to omega-6 fatty acid ratio. And it also has high levels of refined carbohydrates, leading to an increased body mass index, higher weight. These are all associated with an increased risk for rheumatoid arthritis, principally due to high inflammation levels, insulin resistance, and to obesity. Now, diet is also a significant factor influencing the microbiome and its composition, which has been shown to be involved in rheumatoid arthritis disease development. So what does the research prove that we should be eating to reduce rheumatoid arthritis risk and development? First of all, number one, you want to consume foods that are rich in polyphenols. Polyphenols are the most abundant antioxidants in the diet. Fruits, vegetables, fungi, and spices are rich in polyphenols, lowering levels of pro-inflammatory cytokines that lead to inflammation in the body. And these are that are connected with rheumatoid arthritis. Phenolic compounds have antioxidant, antimicrobial, and anti-inflammatory properties. Flavonoids inhibit enzymes that are involved in the production of inflammation in the body. These also increase antioxidant defenses. Now, the most effective flavonoids that reduce rheumatoid arthritis risk and development include genistein. The primary active compound found in soybeans has anti-inflammatory, anti-angiogenesis, and other protective properties against rheumatoid arthritis. Mangiferin found in mangoes, kimferol found in grapefruits, resveratrol found in red grapes, and p-coumaric acid found in grapes, apples, oranges, spinach, tomatoes, potatoes, oats, wheat, and corn. Aspartame found in citrus fruits, and quercetin found in onions and apples. All of these are very potent flavonoids. Also, the spices rich in polyphenols include black pepper, ginger, caraway seeds, cinnamon, paprika, cloves, nutmeg, chili peppers. All of these should be included in the diet on a regular basis to help prevent the development of rheumatoid arthritis. You also want to reduce foods that cause inflammation. Many studies indicate a positive effect of anti-inflammatory diet on disease activities in patients with rheumatoid arthritis. A non-inflammatory diet controls inflammation and reduces the discomfort in all of the joints and the body. Foods that contain refined carbohydrates, gluten, and red meat are the most inflammatory and should be avoided or absolutely eaten in moderation. The glycemic index of carbohydrates has a strong influence on the amount of inflammation that it causes. The higher the glycemic index, the more inflammatory the carbohydrate will be. Therefore, whole grains, which have a lower glycemic index and are rich in fiber, are your best options. Fiber decreases carbohydrate absorption and decreases inflammatory mediators. Therefore, whole grain carbohydrates should be consumed on a regular basis. However, it is advised to avoid whole grains that have gluten in them, such as wheat, and go for gluten-free whole grains instead, since gluten, which is a mixture of many different proteins found in wheat grains, triggers an altered immune response in rheumatoid arthritis. It has been shown. So a few studies show that gluten-free vegan diet followed for more than 1 year was associated with anti-inflammatory properties and a significant decrease in rheumatoid arthritis disease activity. Also, high total protein supply in the diet has been associated with increased risk of inflammation in rheumatoid arthritis patients. Therefore, protein from plant-based sources such as legumes is the best protein source for people suffering from rheumatoid arthritis. Also, legumes have been shown to have anti-inflammatory properties. Red meat intake should be limited to no more than once or twice a month. The foods with the highest anti-inflammatory properties include fruits, especially berries, tart cherries, vegetables, including spinach, potatoes, tomatoes that are rich in lycopene, one of the most potent antioxidants. Also whole grains, especially whole oats, whole grain rice, teff, also nuts and seeds. Now all of these decrease markers of inflammation. There was a study done that showed that 24% of people suffering from rheumatoid arthritis had perceived effects that their diet influenced their symptoms. 19% of people observed adverse effects from sugary drinks and sweets, while 15% reported beneficial effects of foods, especially berries and spinach. Now, you also want to consume a low-salt diet. A low-salt diet seems to have anti-inflammatory potential. High-salt diet, typical in Western world countries, has been associated with increased risk of rheumatoid arthritis. Clinical studies show that high levels of salt could potentiate the detrimental effect of other environmental factors, mainly smoking, leading to enhanced autoimmunity. To consume a low-salt diet, go for natural foods, unlike processed foods that are bathed in salt. Also, when you do add salt to your foods, aim to use a vegetable salt. These types of salts, you can find them on Amazon, are natural salts that are found in certain vegetables, and they actually flavor foods not only with a salty taste, but they're actually very delicious, and they also add some of the nutrients that are found in these dried vegetables. So I really recommend using vegetable salt. And as I mentioned, you can find it on Amazon. Also, you want to consume omega-3 fatty acids. These are very potent anti-inflammatory and antioxidants. They have a protective role in preventing rheumatoid arthritis development because of their action on inflammatory cytokines. Omega-3 fatty acid supplementation in rheumatoid arthritis patients seems to reduce the concentration of inflammatory mediators. So there are many studies that show this. Also, adding foods rich in plant-based omega-3 fatty acids is very beneficial. These foods include seaweed, natural walnuts, chia, and flax seeds. As I always do, I recommend a plant-based omega-3 fatty acid source that may come from sage, chia seeds, or sea vegetables. These are very, very good and do not have all of the toxins that may be found in fish omega-3 fatty acid supplements. Also, you want to consume a prebiotic rich foods. These are foods for the microbiome, for a healthy microbiome. Significant modifications of the intestinal microbiome occurs in people with rheumatoid arthritis. And also these people show reduced gut microbial diversity in comparison to healthy people. I talk about this in my video on sinusitis, so you want to check it out to learn more about how you can add prebiotics into your diet. Also, you want to focus on healthy lifestyle habits, combining physical activity and a healthy lifestyle with dietary patterns to reach an optimal body weight and reduce rheumatoid arthritis disease activity and remission is very, very effective. You definitely want to control your weight. Make sure that you are at your ideal or close to your ideal weight. One study also found an increased risk for rheumatoid arthritis in people that consumed 4 or more cups of coffee a day. So you want to reduce the amount of coffee that you're drinking. Also, you want to make sure that you reduce your smoking. If you are smoking, I would recommend stopping as soon as you can to prevent progression of rheumatoid arthritis disease activity. There are a few supplements that scientific evidence has shown to reduce symptoms and pain, joint stiffness, swelling, tenderness, and the other disabilities linked with rheumatoid arthritis. These include turmeric, which contains curcuminoids that have been shown to prevent rheumatoid arthritis, probably due to their potent anti-inflammatory effect. Also, green tea, which has many, many benefits for rheumatoid arthritis patients. It has anti-inflammatory abilities, and it's also excellent for weight management. It has a EGCG phytochemical that is very beneficial to people with rheumatoid arthritis. It also reduces bone and cartilage destruction through the downregulation of certain enzymes, metalloenzymes, that are involved in the breakdown of the matrix. Now, also boswellia is a herbal extract that has strong anti-inflammatory properties, and its ability to reduce inflammation, relieve bone pain, and relieve pain of the joints and reduce bone degradation and improve joint function makes it an excellent supplement for rheumatoid arthritis patients. I definitely recommend taking it. And I hope this video has helped you, and that it will help you make the right choices to reduce rheumatoid arthritis progression and disease activity. If you liked the video, if you found it helpful, please give it a thumbs up. Please also subscribe to my channel if you want more on how to live naturally and how to heal most diseases in a natural way. And also, please visit my website to help you move your health and wellness and help you lose the weight if you're overweight in the right way for you on my website, thegorilladiet.com. Thank you very much for joining me today.